It's Ashley from Demystifying Your Health. Thank you for joining me today. I am so glad that you're here. Today's video is going to be about chickenpox. And while it used to be fairly common amongst children, it has pretty much fallen by the wayside thanks to the development of the vaccine. However, it's still out there, and some individuals are at risk for it. So, are you one of those individuals? Why is it so important to prevent chickenpox? And what happens if you don't? Let's find out. Chickenpox is an infection that is caused by the varicella-zoster virus. And it's a mild disease, but it's highly contagious. It's spread through coming into contact with the rash or when the infected person coughs or sneezes and someone else inhales these droplets. Symptoms usually begin about 10 to 20 days after exposure, and they usually last about 5 to 10 days. And there's actually 3 phases of chickenpox. The first is raised pink or red bumps that usually appear over several days. The second phase are small fluid-filled blisters that then open and leak this fluid. That usually takes about a day. And then the third phase is the blisters crust and scab over, and this takes several days to heal. Keep in mind, since your body is obviously going to be getting new bumps throughout this period, you can be in all 3 stages at the same time. So, a person is infectious, meaning they can spread the virus to others, from about 48 hours before the rash appears, all the way until all of the blister scabs have actually crusted over. So, this obviously is a long period of time, and it's a big consideration when trying to keep the infected individual away from others so that way you don't give the disease to them. And it's important to note some individuals can actually experience chickenpox twice, and while this is rare, it does happen. Unfortunately, chickenpox can be severe for some individuals, covering their entire body. And in the most severe cases, it can include their throat, eyes, urethra, anus, or vagina. And there are complications that can arise from chickenpox. Obviously, one of the most common is dehydration, just because you don't feel like drinking. And then you also have pneumonia, encephalitis, which is inflammation of the brain, and then bacterial infections. Typically, these are the result of scratching. Obviously, chickenpox is very itchy. So when we scratch, we have bacteria that lives under our fingernails that naturally gets into our skin, causing an infection that's secondary to the chickenpox. And sometimes, though, this bacteria can spread deeper into soft tissue, into your bones, joints, or even the bloodstream. And if it gets to the last 3, this is really concerning because it can actually result in death if not treated immediately. Some groups are at higher risk for developing complications. This includes infants or newborns whose mothers have never either had chickenpox or received the vaccine, for pregnant women who have also never had chickenpox or received the vaccine, individuals who are smokers, those who have weakened immune systems, or those who have to take long-term steroid medications for certain disease conditions. And if a pregnant woman becomes infected during the early stages of their pregnancy, the infant is more likely to have a low birth weight and could have limb abnormalities. If the mother is infected late in pregnancy, the infant, once born, can develop a life-threatening infection. And then there's another complication that's long-term for anyone who's actually ever had chickenpox, and this is shingles. So you have to have had the disease. It doesn't come from individuals who've received the vaccine, at least as far as we can tell, because the vaccine is still newly developed in regards to this. Shingles usually appears in individuals who are older, meaning that they're above the age of 50. Or if they've had a weakened immune system, that's the other big risk factor. And what happens is, once you've had the infection, the virus remains dormant or stays within your nerve cells until something triggers it to reappear. And when it does reappear, it does form small blisters, but typically on a smaller portion of the skin. A lot of people have it where it wraps around from right around their spine all the way around the front, up here underneath their chest area. And these blisters are incredibly painful. Unfortunately, while the blisters will heal and go away, for some individuals the pain does not, and this is known as post-herpetic neuralgia. And this pain can be very intense even after the blisters heal. So this is why if you have the ability to get the vaccine, not only are you preventing yourself, meaning your child, from having chickenpox, most likely they're going to not have to deal with shingles at some point in the future. When it comes to treating chickenpox, the primary goal is to provide relief of symptoms. Since the main symptom is itching, this is the primary focus. The big thing is you want to avoid scratching because it's going to lead to scarring, and it also actually slows healing time. The best way to do this is to put gloves on your child's hands, especially at night, because obviously we subconsciously will scratch at things when we're asleep. And then also trim their fingernails, so that way they're less likely to be able to scratch themselves if they don't have gloves on. And then the big thing as far as relieving itching itself, this you can have them take a cool bath that has either baking soda, aluminum acetate, uncooked oatmeal, or colloidal oatmeal. And then if they're not in the bath, you can put calamine lotion over their body. This usually helps as well. And then the other big factor is over-the-counter antihistamines like diphenhydramine, otherwise known as Benadryl. And this is helpful because it helps reduce just the itching for some. Obviously, depending on the age of your child, it'll indicate whether or not this is appropriate. And then if your child has a fever, the recommendation is Tylenol or acetaminophen. And the reason for that is because children's Motrin or ibuprofen is thought to actually increase the risk of developing skin infections. So if you want to give that to your child, make sure you talk to your doctor first to confirm that it's okay to do so. And never give aspirin to children under the age of 16 because that increases their chances of developing Rye syndrome. So don't do that. And then if there are lesions in your child's mouth, offer them soft, bland food because obviously it's going to hurt for them to eat. So make sure that you're trying to get them to eat and drink as much as possible, but bear in mind that they might not really want to. But you really need to try to make sure they're hydrated at a minimum. As far as those who are at high risk for complications, your doctor might prescribe antivirals. There's several different medicines within this class, so obviously your doctor is going to determine based off of your current medical status what the best one is for you. And then if you've been exposed but you don't have any symptoms yet, your doctor might suggest getting the vaccine. And the reason for this is it will either prevent you from getting the actual full-on chickenpox infection outbreak, or even if you do have an outbreak, that means you're going to have less severe of a one. So that's why it's so important to keep in mind that that might be your best option if you've been exposed, but not necessarily having symptoms yet. So as you can see, there are ways to treat chickenpox. It will heal up on its own. Most of these are to provide relief, obviously, of the symptoms, which is the big concern. When it comes to preventing chickenpox, the best way to do that is to get the vaccine. In fact, it completely prevents infection in 98% of people who get it. So for the unfortunate 2% who do catch the infection after having the vaccine, the good news for them is they usually have less severe symptoms than individuals who've never received the vaccine. It's usually given in 2 doses, somewhere between the ages of 12 to 15 months old, and then again between the ages of 4 to 6 years old. It's important to note if you've never had a chickenpox infection or received the vaccine, you're actually eligible to get 2 catch-up doses. This is especially important for women who are of childbearing age and planning on having children. You must get the vaccine before becoming pregnant because this is going to help you reduce the chances of giving a life-threatening infection to your unborn child. For those who've had chickenpox and are worried about shingles, there's a vaccine for that too. There's 2 types actually. You have the Zostavax, which anyone over the age of 60 can take, and then Shingrix, which anyone over the age of 50 can take, or if you've already received the Zostavax virus. So there are ways to prevent shingles from occurring if you've unfortunately had chickenpox before the vaccine was available. Thankfully today, most kids will never know what it's like to have chickenpox. And if you've had chickenpox, do all that you can to prevent shingles from occurring. Thank you for joining me today. Hopefully you found the information to be valuable and helpful. If you did, please like, share, subscribe. And if you have questions, comments, put them below. I'd love to hear from you guys. And until next time, stay healthy.